how do you ensure the safety and care of the gametes at your centers, sir, like in 39 centers?
Again, that's a very good question. Safety, I think, is something very critical.
Yeah.
And I don't know in other companies how much they are investing in safety. I mean, when we talk about safety in the laboratories, it doesn't have to do with a life and death situation. We are not treating with patients, so we are not in the OT or doing surgeries. We are working with gametes. So safety about gametes is about two main things. One is that everything is working well with our equipment, incubators and everything. Everything is working as it should be with the CO2, with the temperature. Everything is very stable for the embryos. If there is any malfunction, any error in the machines, we need to have that information. That's also safety. We need to be aware that something is going wrong with one of the incubators or refrigerators or liquid and reject tanks. We need to have that information to correct the issue, and that's also safety. And second thing is about traceability. We have gametes from different patients. We have so many patients at the same time. We have strong SOPs to do everything right, but human beings also make mistakes.
Yeah.
We may have also distractions. So we need to have also tools and technologies to help us minimize those errors as much as possible. So safety is something very critical. And again, it's not something which is like AI, something very, very, right now is very fashion, is something very beautiful to sell also to patients, but it's something very basic. We need to have also this investment in safety because probably it's one of the key points for quality in the laboratories.
So what are the key qualifications required for an embryologist to work at 39, sir?
Right now, as per the regulation in India, you need to have at least a master degrees to become an embryologist, to be a master degrees in biotechnology, microbiology, in different aspects. In 39, as much as possible, we try to have people with a master degrees in embryology, because then they have this theoretical knowledge, which is very important for us, and is what really makes the difference. And we have some agreements with some universities, with the best universities that are doing these master degrees in embryology, to have this collaboration in which they can do the internship with us also. So they learn how to do things in the laboratory. We also have this feedback and this idea about how they are also doing things in the laboratory. And if everything gets on well, they will join us afterwards. So we need to have this complete system in which everyone is working comfortably. They know the system, they know how to do things. And we always ask as much as possible to have these master degrees in embryology, this minimum qualification.
So we are talking about the future. So it is growing very rapidly. So are there any chances of malpractice in the future, sir, in related to IVF and ARTs?
I don't think that's a real issue, because right now it's very well established. And the trend right now is that in those places in which the practices are not very, let's say, transparent or very ethical, they are also changing. Because everywhere is like that, so everywhere is moving towards an ethical and transparent practice. Even in India, it has changed so fast in the last 15 years.
Yes.
So fast, because I was here for the last almost 15 years, and I've seen this evolution through the time. So I think in the future, most of the practices will be very well established. So we will have mostly corporates, because it's also the trend everywhere, which are also quite well established with the SOPs, with the control, with the audits, with the whole thing. So I don't think it's a real issue in future.